Good morning. This is a instructional video from nurse practitioner Sosimo Ethikatu, and she's going to explain to us some information about the coronavirus, what tests are done to determine if a patient has an infection, and what type of isolation they need. So I'm going to turn the floor over now to Sosimo. Go ahead, Sosi. Thank you for doing this.
Should I tell the patient's name or no?
No, you don't have to put the patient's name.
Okay. So if a patient coming from the hospital, they're still treated as like they're probably exposed to the COVID, but not necessarily, they have a COVID-19. So we have to monitor the patient, and once they come from the hospital for the respiratory symptoms, cough or shortness of breath or sore throat or fever for 14 days after they're discharged from the hospital. But if the patient, during this time, if the patient develop a fever of more than greater than 100 or respiratory symptoms consistent with the COVID-19, such as cough, shortness of breath or sore throat, implement immediate infection control measures. Immediately, if they develop the fever, sore throat, cough, then residents should be on isolation. Place them in a private room if one is available. If not available, then resident can be, you can separate in a private room. If the private room is not available, attempt to keep the patient or resident 6 feet from other patient or residents. All staff caring for the patient should use the following personal protective equipment. If they are developed this fever, cough, sore throat, or shortness of breath. So if not, you don't need to wear all these protective, just regular mask and gloves. Gloves and wash your hands frequently with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer that contains 60 to 95% of alcohol. Alert the resident's healthcare provider. That's for us, provider, and include that the patient or resident was hospitalized and may have a COVID-19 exposure. So you don't need to, wear all these equipments once, somebody coming from the hospital. So only the mask and gloves and frequent hand washing as regularly what we are using. Somebody, develop fever, cough, then you have to tell the nurse on duty, if the patient is coughing or, they have fever. So we're going to check 3 times. Every shift we will check the temperature. It says 2 times, right?
Mm-hmm. It says twice, but we do it every shift.
We can do, 3 times,
do 3
so
times.
we don't miss,
Yeah.
one
Right.
shift. So any questions for me?
Okay, so
or, anything else?